Tonight, WDSU investigates the vaccination divide. Right now, Louisiana ranks 48th in vaccination efforts. Nearly 30% of the state is fully vaccinated.
And here are the best parishes when it comes to those rates. So Orleans at 40% completely vaccinated, Jefferson at 37%, St. Tammany at 34%, and East Baton Rouge at 32%. But you know, some areas are well below that, and that could impact you no matter where you live. WDSU investigators Travis Mackle and Emily Lane, they hit the road to show you what is at stake.
This is an effort to save lives. State workers going door to door canvassing a section of New Orleans East, urging people to go out and get their shot. This area off Crowder, one of the least vaccinated in the city of New Orleans. About 16% of people here were completely vaccinated as of this week.
It's important to make those connections. It's important to get proximate with community, and it's also important to create access.
16% is low in the city, as some neighborhoods are actually at more than 60, even 85% vaccinated. But state health leaders say the problem spots are not urban areas.
So the numbers really are lagging in a lot of rural areas across the state, and it's really challenging to understand why.
So WDSU Investigates broke down state health data across southeast Louisiana, identifying the areas with the lowest percent of people vaccinated. We went to the 3 areas with low vaccination rates, looking for answers to the question, why are people not getting the shot? One of those places, a part of Tangipahoa Parish, not far from downtown Independence. According to the Louisiana Department of Health, about 10% of people here are vaccinated. To put that into context, just over 6,400 people live here, so roughly 650 have completed the vaccination series.
The reason why a lot of people ain't getting the vaccine is because they're saying that the vaccine was killing people from the start.
We need to point out there are no reported deaths in this state or any state from a COVID-19 vaccination shot. We caught up with Elaine Baptiste. Why do you think people may not be getting them?
Afraid, that's all I can say.
In that part of Tangipahoa Parish isn't the only area across southeast Louisiana with sagging vaccination rates. Lafourche Parish also has some low numbers. For more on that, here's investigative reporter Emily Lane.
Travers, that parish has a vaccination rate of just over 20%. But one area has a vaccination rate that's barely in double digits.
The La Rose area, located on Bayou Lafourche, has a 12% vaccination rate. Over 5,300 people live here, according to census data. About 650 have completed the vaccination series. 70-year-old Beverly Chauvin isn't getting a shot.
If they like me, it's because of my illness. I'm a diabetic. I have migraine and I have blood clots in my legs. And it scares me.
When I see areas with such a large proportion of people not yet vaccinated, I really worry.
State health leaders, like Dr. Joseph Cantor, say a lack of availability can no longer be used as an excuse.
Now it's broadly available. It's in over 1,500 vaccine provider sites across the state, almost every Walgreens, almost every CVS, almost every Winn-Dixie.
That's why Dr. Cantor is urging people to get a shot. But again, that plea appears to fall on deaf ears.
A lot of people just have questions. There's a lot of myths. If you go on social media, there's all types of nonsense being said about the vaccines. People say it has a microchip and all types of bizarre things that really aren't true.
The mask mandate has been removed in every parish but Orleans, and so have almost all COVID restrictions, meaning many unvaccinated people are walking around and possibly traveling parish to parish, taking no precautions.
And this virus knows no parish line. So we have quite a few folks on the North Shore who work in New Orleans and the metropolitan area.
And that means the consequences for not getting vaccinated could impact us all. The health of our kids, our parents, and possibly even events across southeast Louisiana could be in jeopardy if the vaccination numbers don't improve.
If I'm vaccinated, why should I care if my neighbor is not vaccinated?
You know, there's still that chance of catching COVID or transmitting COVID unknowingly. So in order for us to truly begin to create that that herd immunity, we need to get as many people vaccinated as possible.
The third area we've identified is Gray, which is in northern Terrebonne Parish, not far from Highway 90. For more on that, let's go back to Travers.
That's right. We spoke to people here who say no thanks to getting a shot.
I think they're hesitant because they currently don't trust the government with elections and everything else that went on. I think there's a lot of distrust right now.
About 14% of people in this area are vaccinated. Over 4,100 people live here based on census data, so slightly more than 550 are fully vaccinated. Mia Bergeron also has not received her shot.
They're just scared of, they've heard stories about the blood clots and stuff.
For people in rural areas, what is your message to them?
It's that COVID is just as dangerous in the country as it is in the city.
Meaning statewide, we could all be impacted.
Could there be another spike?
Yes, there can always be another spike. And that's what we're trying to avoid.
With Emily Lane, I'm Travers Mackel, WDSU News.